I was in the health insurance industry for 20 years, and I was a spokesperson for two of the largest for-profit health insurance companies in the country. There are 7 very large for-profit insurance companies that dominate the industry. They're all traded, their stock is traded on the New York Stock Exchange. 1 out of every 3 Americans is now enrolled in some kind of a benefit plan, a medical benefit plan, offered by one of those 7 companies. So the landscape has changed radically from when I first got into the health insurance business. I worked for Humana and Cigna, as Edward mentioned, for about 2 decades, 4 years at Humana and then a little over 15 years for Cigna. And I learned a lot while I was there. And I will say that when I first got into working for the health insurance industry, I really was a firm believer in the free market and market forces that could, I thought, really shape our healthcare system and whip it into shape, make sure that more and more of our citizens were covered and that we were getting quality care. I was a willing advocate and proponent of managed care, and I tell you that there were times when I later, after doing that for a few years, did not want to admit that I was a PR guy for an HMO, but I was, and pretty proud of it, quite frankly, for quite a long time, because I really did believe that the concept of managed care could help people and could help in ways that they hadn't been helped before in getting access to quality care. But what I realized, the higher up the corporate ladder I climbed, was that the profit motive trumped all that. And I saw that up close and personal. I was becoming increasingly uncomfortable serving as a spokesman for the health insurance industry for the last 2 years probably that I was in my job. One reason is I knew that if I stayed in my job, I was going to have to play a significant role in helping probably to defeat health care reform after the President took office and the new Congress took office, just as I had in years past. When I first went to Cigna in 1993, we had a new president then, and Bill Clinton and Hillary Clinton were, as you well remember, most of you do, were trying to pass significant health care reform. And I was among those who made sure that didn't happen. And I regret to say that I was pretty successful, and my colleagues and I. One of the things you may recall is that the health insurance industry sponsored a series of television ads that were very, very effective in scaring people away from reform. Featured a fictional couple called Harry and Louise. And Harry and Louise were sitting around at their kitchen table, and they were talking about health care reform. And the whole reason that that was on TV was to make people begin to doubt the fact that we needed to have health care reform, and to make people afraid of the kind of reform that the Clintons were proposing. And they were awfully successful. I think, looking back, a lot of people attribute the demise of that plan to that series of commercials. But really, it went much deeper than that. The health insurance industry joined with other sectors of the health care system to kill it. And they worked behind the scenes, and they used some of the devious means that I describe here in my book, Deadly Spin. And I wrote this just to pull the curtain back so that people can really understand why it has been so hard for us to achieve meaningful health care reform in this country. And it has been because of the strength and the influence and the money that the special interests have. We've been at this really for 100 years. I didn't want to be a part of this again. I knew that the country had really reached the point of being our healthcare system in even more of a crisis, far more of a crisis than it was back in 1993 and 1994 when the Clintons were trying this. I had seen it really unravel and becoming a system that served fewer and fewer Americans. In 2007, when I was really beginning to have my doubts about continuing in my job, then there were 46 or 47 million Americans who didn't have insurance at any time during a given year or during that year. Now it's well over 50 million. And there's another 25 million that are in the ranks of the underinsured. That means that they are now in plans that have had such high deductibles or such limited benefits that they're paying monthly premiums for for coverage that is not going to be adequate for them if they do get sick. And they'll be having to pay at least 10% of their income if they do get sick. That's what essentially qualifies them for being in the ranks of the underinsured. And I was becoming increasingly aware that the practices of the health insurance industry was directly responsible for the growing number of people in both categories, both the uninsured and the underinsured. And I was becoming increasingly uncomfortable being a spokesman for an industry that I could tell was making matters much worse. It was not part of the solution, as I was trying to make people believe, and certainly making reporters believe. One of the responsibilities I had for really 10 years at Cigna was to work with financial reporters at the Wall Street Journal and Dow Jones, Reuters, Bloomberg, the New York Times, any financial reporter that was interested in how Cigna made money. I was the person they called. I worked very closely with our investor relations department and our chief financial officer and our CEO and the heads of our separate businesses, so that I would know exactly how the company made money and how it met Wall Street's expectations, or why it did not if it didn't meet Wall Street's expectations, which, by the way, is something you do not want to happen. You do not want to disappoint Wall Street. There are two measures that investors look at and Wall Street analysts look at for health insurance companies. One is earnings per share, which is what they look at for any publicly traded company. How much money did you make, and how much on a per share basis did you make, because that's important to them. The other is unique to the health insurance industry. It's the medical loss ratio. And you may have been hearing more about that recently. And again, it was what we were discussing here in Seattle with the insurance commissioners back in August. That is the term that is used in the industry, and it's significant that is medical loss. The word loss is in there because insurers consider it a loss to them when they pay claims. When they serve you, it's a loss to them. So I was very much aware of the medical loss ratio and the fact that investors were constantly pressuring the executives of every for-profit insurance company to ratchet down that medical loss ratio year after year after year. In 1993, I think as I mentioned before, insurers spent on the average 95 cents of every premium dollar on medical care, on paying claims. By 2 years ago, it was down to about 80 cents of every dollar. And if it weren't for this provision in the new health care reform law, you can bet your bottom dollar that it would be going down even further. In fact, already a lot of insurers pay far less than 80% on medical care. And I was seeing what the insurance industry did to make sure that that medical loss ratio was going down to meet Wall Street's satisfaction. And by the way, just to give you an example of how much these companies can be punished on Wall Street if they disappoint investors with a medical loss ratio. Aetna, a few years ago, disappointed Wall Street greatly by reporting a medical loss ratio that was 79.2%. And it had increased from like 77.9% in a year's time. The investors were so upset with Aetna and that performance that the stock dropped 20% in one single day. So at the end of the day, the folks who own stock in Aetna had lost a huge amount of their investment. And the executives, who all get a lot of stock options, saw the value of their stock options drop dramatically. And in many cases, undoubtedly, their stock options were what's called underwater. They were valueless. So that's why they do not want that to happen. They want to make sure that they're always satisfying Wall Street's needs and Wall Street's expectations. One of the ways that they meet those expectations is to engage in some practices that this new legislation will make illegal. You may have heard the term rescission, and this is a practice in which insurance companies will go back and check a person's application when they have applied for insurance to see if they might have omitted something that was pertinent, or they might have lied, they might have misrepresented their medical history. They do that because when you get sick, if you get very sick or very injured, you will have pretty expensive medical care. There was a woman who testified before Congress that was investigating rescissions, and they were looking at just 3 for-profit companies over a period of 5 years, and they found that just those 3 companies had rescinded or canceled 20,000 policies. And that sounds bad enough, but the reason they did is they knew if they canceled those policies, what was the result was they saved or they avoided paying out $300 million in claims. So they looked for the big ticket items. They looked to get rid of the people who were the sickest. There was a woman who testified on a House panel last year whose policy had been rescinded. She was still, when she testified, in the midst of being treated for breast cancer. She testified that she got a notice from her health insurer that it was canceling her policy, meaning that she would have to pay every dime of her medical care or go bankrupt or lose her home if she couldn't pay it. The reason was that she presumably had forgotten to include on her medical application, her insurance application, that she had been treated for acne in the recent past. So they will look for anything, and they might just know that they can get your medical history. They know a lot more about you than most any of us realize. I was becoming really sickened as I became aware of some of these practices to meet Wall Street's expectations. Another that I was very personally familiar with is a practice called purging. And when an insurer purges an account, we're talking here about small businesses. Over the past 15 to 20 years, we've seen the percentage of small businesses offering insurance to their employees drop dramatically. It used to be well over 2/3. Now it's less than half, far less than half, really. And that's because they can't afford to keep offering coverage. And the reason is because when an employee gets sick of a small business or a dependent of an employee gets sick, it kind of skews the experience of that group during a given period of time. And underwriters then have missed what their expectations were. So when that book of business comes up for renewal again, the insurer will jack the rates up so high that the small business usually has no option but to drop insurance for all employees. And just think about that. If one person gets sick, the rates will go up so high that the small business usually will have to drop coverage for everybody. They sometimes try to shop around to see if they can get a better deal somewhere else, but you have to show your claim experience, so it's really hard to go from one insurer to another. Some will try to offer a cheaper plan, actually one that costs about the same but has far fewer benefits as an alternative. So that's another reason why we're seeing so many people who are in the ranks of the underinsured. That was another reason I did not want to be a part of that industry. I could no longer, in good conscience, represent and be a spokesperson for an industry that was doing this kind of stuff just to meet Wall Street's profit expectations, and it's going on right now. And this year in particular, it's been some of the worst behavior. The insurance companies are on a path to have the most profitable year this year than they've ever had. In the first 3 quarters of this year, their profits have just blown away Wall Street's estimates. It's just been phenomenal. And one of the reasons is because they've been reporting that the utilization of healthcare services is much lower than it was last year. And one of the big reasons for this is because they've moved more and more of us into these high deductible plans and limited benefit plans that we're not going to the doctor like we used to. A lot of people are not getting the care they need when they need it, and they're not going to the drugstore to get the drugs that their doctors say they need. So consequently, they're not using their benefits because the benefits are not there for them. One insurer in Maine, and this would be a trend across the country if it were not for this legislation, which limits this, but one insurer in Maine, and one of the for-profits, is offering a product with a comparatively low premium, but the out-of-pocket expenses, the deductible is $30,000 a year. So folks, that is what the insurance industry wants to move us all into. They have a euphemism for these plans. They call it consumer-driven care. They want you to think that they're putting you in charge of your health care, but what they're doing is screwing you royally. And I knew what was going on. I knew this game, and I did not want to be a spokesman for it. So I mean, there were other things that happened, in particular during 2007, that led me to quit, but I did. I left my job in early 2008. And I went for a year not knowing what I was going to do. I was still I was 55 when I left, and I didn't have plan B. I didn't know what I was going to do. I just knew I wasn't supposed to be doing what I was doing. I was doing some consulting work, and I did not have any idea that I would ever have the nerve to be a public critic of the industry that I'd worked for so long. But in March of last year, I was watching TV. I was watching the president, or at least some coverage of the president's first summit on healthcare reform. It was on March the 5th of 2009, and he had invited the special interest to come to the White House to talk about reform and how we can all work together to achieve what we've never been able to achieve before. He thought that he would be able to work with these folks, and they could be trusted to do the right thing. He really did, apparently. And one of the people who spoke was Karen Ignani, who is the head of America's Health Insurance Plans, which is the trade group, the big trade group for health insurers. And she got up, actually the president called on her toward at the end of the summit, and he asked her to speak. And here's what she said: "You have our commitment to play, to contribute, and to help pass health care reform this year." Well, when I saw that, I said, well, she is playing the president like a Stradivarius. And she clearly was, because I knew that behind the scenes, the health insurance industry was devoting millions of dollars, your premium dollars, to help derail reform, or at least not to kill it necessarily, but to shape it in a way that would benefit them. During some of my testimony before Congress, said that, and I was a big proponent of the idea of a public option. Congress didn't even start. Thank you. One of the biggest strategic errors, I think, that the Democrats pulled was not starting with a real discussion of a single-payer system in this country. So what they started with was something that was already a compromise. They started with an idea that really contained a lot of Republican ideas from years past, but at least the legislation as it moved through the House and as it was passed by the House included a public option, a government-run public option that would compete with private insurance companies. And I said during testimony that if the Congress did not, if it passed a bill that did not include a public option, they might as well call the bill the Health Insurance Industry Profit Protection and Enhancement Act. And as we know, Congress passed a bill that does not include a public option. It does include something the health insurance industry really lobbied strongly for. And it's going to be interesting to see how things play out in the next Congress, because the Republicans are claiming they don't like this a bit. Their favorite part of this bill is the requirement that we all have to purchase insurance from them. And that was job number one, was to get that included in the bill. Job two was to strip out the public option. So they won those two victories. I was very, very disappointed when the bill was before the Senate, and it was abundantly clear that the public option was not going to be a part of the final bill. But nevertheless, I said publicly that I thought that we needed to get something passed. And I expressed support for Congress going ahead and voting for what had to be, at that time, the Senate version of the bill, because of what happened in Massachusetts and the Democrats losing their filibuster-proof numbers in the Senate. So there was no alternative but to pass the bill, or there would be no bill passed at all. So I disappointed a lot of people on the left, a lot of progressives, when I said that. In fact, some people wrote in blogs that they thought I was probably a double agent for the insurance industry. I was called a corporatist, and I hadn't even heard the word corporatist, but that's what I was called. And I guess I had been a corporatist for a long time, but I certainly was not. I'm going to read a little bit here about, that might put this into perspective, but one of the reasons I wrote the book, there are various reasons, but one is to to just describe why it has been so hard to even get what we got. We've been trying this for 100 years. And I'll read this, and we'll talk a bit more, and then I'd like to just have a conversation with you and answer some of your questions. This is chapter 10, the title of which is A Victory of Sorts. After nearly a century of failed attempts to enact universal health care, everyone knew that the fight that began when Barack Obama took office would be arduous. I knew better than most, but even I didn't foresee the ferocious warfare we would endure for more than a year. The struggle eventually did put our country on a new path toward remedying injustice in health care. But thanks to the shrewd and well-funded operatives of the health insurance industry and its allies, not 1 inch of this ground was gained without political turmoil. Obama's election in 2008 electrified the nation and much of the world. It left him well-positioned to take on the big challenges if he acted quickly, and he wasted no time. Even as he moved into the White House pushing a stimulus bill to counter the economic disaster created by the collapse of investment banks and other financial institutions, his staff geared up for a quick start on health care reform. His opponents portray him as a socialist and a radical, but in truth, Obama is not even a hardcore liberal. He's a moderate centrist who often leans to the left. He may be socially liberal when it comes to reform. He once said that if we could start from scratch, he would support a publicly financed single-payer system. But he's also a pragmatist who understands the political realities of Washington. Obama rose to power partly on the strength of his ability to adapt to different audiences. Quote, "My experience being able to walk into a public housing development and turn around and walk into a corporate boardroom and communicate effectively in either venue means that I'm more likely to be able to build the kinds of coalitions and craft the sort of message that appeals to a broad range of people," he said in a 2000 interview. Obama's fervent supporters often thought they heard more than they really did. Still, his 2008 campaign promises about health care were fairly clear. Crafted with the help of Harvard economist David Cutler, Obama's original plan called for employer mandates, federal coverage of catastrophic cost, and tax credits to help low- and middle-income families afford private health insurance. As I noted earlier in the book, he opposed any requirement that everyone buy insurance, one of the few points on which he disagreed with rival Hillary Clinton. His platform also called for the creation of a public health plan to compete with private insurers, as did Clinton's and that of his other early opponent, John Edwards. But Obama never promised to fall on his sword for a government-run plan. In the end, Obama produced a legislative victory that will accomplish much of what the Clintons had hoped for in their earlier effort: expanded coverage and somewhat controlled cost. It will add 16 million people to the state Medicaid programs through expanded eligibility rules. It'll offer tax credits to about 16 million more people in families earning up to 400% of the federal poverty level, which is about $88,000 for a family of 4. And according to the Congressional Budget Office, it will reduce the federal deficit by $143 billion over 10 years. The legislation falls short in other respects, most disappointingly, of course, in that it did not include a government-run public option to compete with private insurers. But politics is the art of the possible, as Otto von Bismarck said, and in the end, President Obama and his chief of staff, Rahm Emanuel, calculated that sacrificing the public option was a price worth paying to nail down other significant gains in the bill. Obama's victory is really just a pit stop in an ongoing contentious battle that split the country wide open while showcasing the skill of corporate America at getting what it wants in a white-hot, polarized media and political environment. The stakes were high, and clashes over health care reform erupted in every corner of the nation, opening wounds and reviving tribal grudges from generations ago, like a dormant volcano brought back to life. Health insurers and other special interests opened their pocketbooks to frustrate reform and protect huge profit streams. Political front groups flourished, nurtured with millions of dollars from shadowy corporate sponsors, including health insurers. Powerful images and words were unleashed. Anti-reform operatives concocted myths, libeled Democratic leaders, and used racist slogans and pictures, and questioned the patriotism of people supporting a just health care system. Fox News eagerly broadcast these antics and messages morning, noon, and night. And perhaps most important, the health insurance industry showered members of Congress with political contributions and overwhelmed them with thousands of lobbyists to push its propaganda. Guided by professional political organizers with deep roots in the Republican Party and the lobbying world, notably former House Majority Leader Dick Armey of Texas, opponents of health care reform mounted shrill protests that led to the formation of the Tea Party. The GOP made the political calculation that killing health care reform, at least as envisioned by the Democrats, was its leading hope of regaining power. This belief was crystallized in a quote from Senator Jim DeMint of South Carolina, who said that the defeat of the initiative would be Obama's Waterloo. Well, we know it was passed. It was that watered-down bill that did not include a public option, but that did include the individual mandate. So clearly, the insurers won that round. They don't like a lot that's in the bill. There are consumer protections, as I said. They will no longer be able to cancel anyone's policies just because they got sick and the insurance company doesn't want to pay for it. They'll have to really prove that fraud was committed. They will no longer be able eventually to not offer coverage to someone because of a pre-existing condition. Right now, if you don't have insurance and you've had a history of almost any kind of an illness, and you're of a certain age, you can't buy insurance at any price in this country. So this will make sure that people can get coverage. They will not be turned down in the future. It will require them to keep young people on their families' policy until age 26, which is really important. I have two kids in their 20s. I have a daughter who's 23, and she doesn't have a job that offers benefits, so she can come back on my policy. That's important. And it will close, among other things, it'll close the donut hole in the prescription drug benefit for Medicare beneficiaries, which is something that's really very important for senior citizens. My dad regrettably died last week, a week ago today, and he had been in great health until his 90th birthday, and he had a stroke that weakened him, and he lived to be 93. But the old man's friend came to visit, pneumonia, and it took him out last Wednesday. But he and Mom both were, at this stage in their life, I still have my mother, using a lot of medications, and I'm sure almost everyone, not everyone, but a lot of folks in here undoubtedly are taking medications. And the way the drug benefit was crafted, my mom and dad and anybody really who's a beneficiary will have to pay $4,550 out of their own pockets when they reach the donut hole before the government will start paying for the drug benefit again. So between them, they would have to pay more than $9,000 just for their medications. And this is another reason why people stop taking care of themselves. They can't afford, if you're on a fixed income, as many seniors are, and a low fixed income, sometimes you have no alternative but to stop taking your medications. This legislation will eventually close that donut hole. So there are a lot of good things in this legislation, but there are things that many of these things are things that the insurance industry does not like. One of them, again, is the requirement that they spend at least 80% of what we give them in their premiums on medical care. They'll be working with the Republican members of the House and the new Republicans in the Senate to try to strip out some of these consumer protections. That's why they were behind so much of the campaign rhetoric that we heard leading up to the midterms. We heard a lot of politicians saying that we needed to repeal and replace this legislation. And the insurance industry was financing a lot of that, knowing that it was not going to be repealed. They would not stand for that. But they knew that if candidates were saying this, it would scare people in thinking that this legislation was really very socialistic, that it really did represent a government takeover of the health care system, which it does not, but those are terms that my colleagues and I used to craft to scare people and to feed to politicians, both those are elected and those running for office. So they've bought a fair number of members of Congress, and they will be taking office in January. We probably will be seeing that we'll see a lot of hearings being held on both sides of the Capitol, both the House and the Senate, with the Republicans in control of the House. Republicans will be chairing those committees, so they can determine the agenda, they can determine the witness list, they can determine exactly what's investigated. So we'll be seeing a very insurance-friendly House when Congress goes back into session. It won't be quite that way on the Senate side because it's still controlled by the Democrats. You probably will see that the House Republicans will pass something to repeal this legislation. They will feel obligated to do that because they campaigned on that. But what's going to happen is that when they come into office, probably the first day, they'll get a visit from a health insurance lobbyist who will say, here's the deal. We helped you get into office. We know that you campaigned against health care reform. You probably will have to go through the motions of holding these hearings and discredit the legislation, and you'll probably have to vote to repeal it. But we don't want it to be repealed. And we know that the way things are going to work out, that the Senate will not repeal it. So you can go ahead and pass it if you want to. It's not going to pass the Senate. And even if it did, the President would veto it. I hate to be cynical, folks, but that's the reality. That's what's going to happen. And the end game here is not to repeal it, but to continue to turn people away from reform, to get people angry and scared enough that the Congress can persuade us to think that some of these consumer protections represent socialism or a government takeover of the health care system. So watch the language. Another reason I wrote this was to make sure that, well, I can't make sure, but to hopefully communicate how these special interests are so successful in manipulating our thoughts and our actions and getting us to vote against our own self-interest time and time again. And we've seen this, as I said in this chapter, for over 100 years. That's why I ultimately decided we needed to get something passed, as flawed as it is, as inadequate as it is. There's so many things that it does not address. There undoubtedly will be unintended consequences going forward that will have to be addressed. It is not getting us a single payer any time in the near future, but it does some good. And the ultimate reason I decided to vote for this is, at the very beginning of this book, I said that 45,000 people die in this country every year because they don't have health insurance. That's a figure based on studies by Harvard researchers. And I say that, you know, I hate to admit this, but I was at least partially responsible for that statistic because I, for many years, helped to perpetuate the myth that the free market system could solve our problems. It really cannot. And the government really does need to have a very significant role in our healthcare system. The free market system, the invisible hand of the market, does not work in every sector of the economy, and it certainly does not work in healthcare. I'll stop at that, and I will look forward to having a conversation to answer your questions on anything that you want to ask, and I'll try to answer it, and if I don't, I'll say that. I don't know how to answer it. One of the things that's been so liberating is that I'm able to tell the truth, and if I don't know something, I'll say it. I don't have to worry about offending a CEO or worrying that I'll be misquoted. So I like being candid. Thank you.
Thank you for coming, and I commend your courage.
Thank you. Thank you very much.
You said it took you 18 years before you decided you would go a different direction. I'm wondering if it took 18 years to figure out what was going on, if it took 18 years before you were able personally to change directions.
It was some of both. Here's what was going on. Like I said, I really felt that managed care and some of the techniques of the insurance industry could work and would be fair. You have a lot of people who work in the insurance industry that are good people, and when you're in the lower levels, you come in and you do your job. You think you're doing a good job, not just for the company, but for the greater good, for society. And in many cases, that is probably true, or at least for the members or the people who are enrolled in the health plans, if they do get the coverage they need. you really can't see the forest at that level, and I didn't for a long time. It was only during the latter part of my career when I really was a senior executive that I was able to see and had to know, as I said earlier, how these companies make money and the lengths they go to. So it was a gradual education process for me. But you raise a good point. The other is that even when I became aware of that, it's hard to just step away and not do it anymore. And people often ask me, why don't other people do what you're doing? And it's because you're afraid to do that. You're afraid to walk, especially if you're in your mid-50s and you don't have a job, another job to go to, and you got a mortgage to pay and college tuition that you got to pay, and a lifestyle that you've created based on what you've been making. You become trapped in that, and I think most Americans are probably in that category. Many Americans have mortgages that they really shouldn't, that it's too much for them. Our debt in this country is significant. That benefits corporate America because they own us to a large extent, and it's really hard to walk away from something because of financial reasons. So that was one reason. I have a family. It's not just me. I had to think of others as well.
Well, thank you. I appreciate that honesty. Just quickly, in the bipartisan commission, debt commission, or the deficit commission, they came out and said we need a public or government option or a public option to start to control healthcare costs. What effect do you think that'll have on the whole debate?
Well, I think it's a good thing that it's in there, and I think we can get back someday to looking at a public option, but I think it frankly will have to start at the state level. I think some states will look at it and it may be enacted at the state level. I know Oregon and maybe even here and Connecticut, some other states are looking at that. Vermont has a new single-payer advocate as a governor, and some states will be doing some innovative things. Others will be going the opposite direction and trying to avoid implementing this legislation even as it's been enacted by Congress. So we'll see a lot of variations in how this is implemented at the state level, but I think there can be some good innovation at the state level, and we might see the beginning of interest in a public option, and maybe even, my view is that this a single payer system, if it ever starts in this country, probably will start like it did in Canada. There it started at the provincial level. I think it would start here at the state level.
Hi. Yes. I'm an insurance verifier, and I've been one for a number of years. So I've noticed especially over the last 8 years, how all of the major insurance companies began just purchasing all of the small insurance carriers around the country, creating these huge megalopolies of insurance. And I was wondering, was that a planned strategy back then? Yes. And what was that planned for? What was their intention with that? Because I watched it, I could see it happening. I didn't understand what it was all about because they bought companies that did stupid things like, you know, they had $2,000 yearly maximum benefits, which is just a crime, an absolute crime. And I always felt that way about it. But I wondered if you could talk a little bit about that, and also could you tell us what the medical loss ratio was decided upon by the insurance commissioners? What the percentage was? Okay. Thank you.
I'll answer that. The insurance commissioners had to stick with what was in the law, the statute, and it was 80% in the individual and small group market and 85% in the large group market. And what the NAIC had to do was define what constitutes medical care. The legislation says that the insurers can count claims, what they pay out in claims, and also the money they spend to improve quality of care, but it didn't define that. So obviously that could be a loophole big enough to drive a big truck through. So the insurance commissioners had to determine how to define that. And fortunately, what they did was fairly consumer friendly. The insurance companies were not at all happy with what they did. So they will be continuing, they already are, continuing to lobby. They're trying to get waivers out of the Department of Health and Human Services, which has the responsibility of administering it. Now, getting back to your first question, it was indeed a strategy of the big for-profit insurance companies to buy a lot of competitors, smaller competitors. I was very much aware of the mergers and acquisition strategy of my company and others. When I joined the industry, no one had ever heard of either WellPoint or United, or very few people had at that point. Now they're the two biggest in the country. WellPoint became so big because Blue Cross plans were able, they were given the capability of converting from nonprofit to for-profit status. Many of them have. WellPoint emerged to start buying them all up. United became the behemoth that it is by buying the healthcare businesses of MetLife and Travelers and other small other businesses along the way. Cigna did the same thing. There's been an enormous consolidation in the industry, and that's why I say that we have now a cartel of 7 very large insurers. The reason is because size matters in health insurance. If you are big in any given market, you have more clout when you're dealing with providers. You can negotiate down. You can make them, they need you for their business. And so you're stronger at the negotiating table. And you have economies of scale that the small players don't. They have made some stupid acquisitions, you're right. But one of the reasons they bought some of these companies that offer crappy policies is because they wanted to offer them. You can make a lot of money on those. That's exactly why they did that.
Yeah.
So yes, it was absolutely a strategy to get big, and the consolidation will continue. One of the things that this legislation does is, for better or worse, it will probably get rid of a few more of the bad actors in the industry. But that means that the big insurers will just keep getting bigger.
Thank you very much.
You're welcome. Yes, ma'am.
My name's Nancy Spaeth, and I'm a nurse.
Hi, Nancy.
I understand your father. My mother had a stroke and died of the old person's friend as well.
Is that right?
Yes.
I'm sorry.
And it is a blessing in the end.
It is.
Yes.
It is.
I have spent years as a nurse doing something I was never trained to do in nursing school. I became a saleswoman, selling medical care to the insurance companies. I spent hours on the phone convincing them that this care was needed for this patient. And therefore, I was a salesperson. Nobody trained me to do that.
Yeah.
And I watched the denials, and I thought all the time about how much they were paying all that bank of people to say no to me, and how much they were paying nurses to spend their time on the phone with insurance companies instead of with patients.
Right.
That drove up the cost.
Yeah.
I also watched doctors over the years have less time with patients, running like hamsters on wheels, taking their dictation home at night, because they had to work faster and harder because they were being paid less and less, and the premiums were going up. So I've watched this take place over the years, just like Kathleen has. So one of the things that really stands out for me is the people who listen to the sound bites on Fox. And when I try to promote healthcare for everyone, they use these sound bites on me. So I was hoping you could give me some to use back.
Well, that's a very, very good point, and I appreciate that. One of the things that I tried to counter the allegation or the claim that this represents a government takeover of the healthcare system is that it's not true. It does not. And if you really read the legislation, you'll see that it does not. Most people make those comments without having read any part of the legislation. So I say, please do take a look at it and let me know where it says that. The other thing I do, though, is it's not a government takeover of the healthcare system. What we have had over the past several years, while we were not paying close attention, is a Wall Street takeover of our healthcare system. And it's the truth. It's not a lie. But it's a soundbite, admittedly. But you need to have short phrases like that you know, really conjure up an image of what the reality is. And the book here offers some other suggestions. But one of the things we're going to have to do beyond messaging, and one of the reasons Claire McCaskill, Senator Claire McCaskill of Missouri, was quoted as saying, and I saw her say this in an interview just shortly before the House was voting, and she was asked, what happened? How did it happen that we're having to give up the public option? And she said, we lost the messaging battle, and it's true. It's that simple. The Democrats, the advocates of reform, were never able to counter these lies, and so we really need to work and develop our own strategy for communicating in ways that we haven't. I kept waiting for the White House to communicate in ways that I thought they could and should. Obama was quite the communicator, and I thought could reach people emotionally, and that's why he attracted such a broad spectrum of voters. But it seemed like that man just disappeared when he got into the White House.
I had one little thing I wanted to say about the bill that I really appreciate. I had a mother in South Carolina contact me over the internet because her son started dialysis as a senior in high school in March and was graduating from high school, and she was so worried about health care insurance for him. When I informed her that he would be covered until he was 26, she didn't know that. But she did call and advised her to call her insurance company and verify it, and they did. And she was very happy to know.
That's a very good point, and I ticked off some of the benefits that are in the legislation. And one of the things you're finding, that the pollsters are bearing this out, that even people who say, well, we need to repeal and replace this bill, when you say, well, do you want the part repealed that closes a donut hole? Do you want to repeal the provision that lets your kids stay on your policies until age 26? Do you want to repeal the part that allows insurance companies to not sell you insurance when you're sick? Do you want to repeal the part that allows them to cancel your insurance just because they want to? Is that what you're wanting?
Thank you.
Yeah. Thank you.
Thank you very much.
Yes, sir.
First a short comment and then a short question. My short comment is that it's often said that passing legislation is the easy part, and now comes the hard part, which is making the rules that implement that legislation.
Very true.
And you can believe that right now the lobbyists are working very hard with the new members of Congress and the old members, of course, Republicans primarily, to modify the rules that are being proposed to implement this legislation. So it behooves everyone to watch this process very closely and to make sure that they don't weaken the legislation or create rules that weaken the legislation, shall we say. That's the price of good health care. You talked about for-profit insurance companies in this country and how they operate, but there are some health care plans in Europe, in particular Switzerland, where health care is provided by not-for-profit insurance companies. And I'm wondering, do you feel that a not-for-profit insurance company would do a better job than a for-profit insurance company in health care?
I do, if they are sufficiently regulated like they are in Switzerland and other countries where there are competing insurance companies. And you're right, in Switzerland and other countries where they have a similar system, all the insurance companies are nonprofit. That's a big difference. And when I worked for the Baptist Health System of East Tennessee, it was mainly a hospital system. It also had an HMO. It was operated on a nonprofit basis. I didn't really understand the distinction between nonprofit and for-profit until I left to go to Humana, and it was really quite an awakening eventually that I learned. But the nonprofits now have to operate pretty much by the same rules that are set in the industry by the big for-profits. So they have to play the game pretty much the same way to stay in business. They benefit from that, and as you know, a lot of the big Blue Cross plans have enormous surpluses, and probably far more than is necessary. They'll argue that it's not. But I think that it is possible, if this legislation is enacted as intended, if it's not weakened, if the regulations are not stripped out, we'll see that the for-profits will not be able to guarantee those profits that Wall Street wants. And they will demand that these insurance companies do something else, or they'll take their money elsewhere. That happened. I saw that evolution happen in this industry over the 20 years I was in it. Like I said, no one heard about WellPoint or United. And when I joined Cigna, it and Aetna were big multi-line insurance companies that had a property and casualty division, and it had a financial services division. Investors, Wall Street demanded that they get rid of everything except what they wanted to focus on. They wanted them to focus on something they could understand. So Cigna and Aetna went toward healthcare. Travelers, Prudential, MetLife decided to get rid of their healthcare operations and focus on something else. My point is that they evolve. There's been an enormous evolution in our insurance industry that will continue. And if these regulations mean that they can't deliver the profits that Wall Street expects, Wall Street will demand that they do something else. And I think that one of the things that could happen is that health insurance will become commoditized. There will have to be an essential benefits package that they all have to offer. There will be rules that will be in place that will make it harder for them to meet those profit expectations. So my hope is that they will eventually go into some other line of work.
Somewhere in your life, you learned something that gave you the strength to do what you're doing today.
Yeah. I'm in my mid-50s. Well, now I'm older than that now. I'm getting close to 60. But there is something that I think you begin to do maybe as you're getting older. You think of you know you're mortal. I looked at my own dad's life in his 90s, and I was convinced that my dad, when he would be on his deathbed, that he would have no regrets about how he lived his life. He's a wonderful man, and I always wanted to never disappoint my dad, but I also wanted to think, when I was on my deathbed, I did not want to have any regrets about my life. And I was just so consumed with that thought. Maybe most people don't do that, or it's not weighing on them as much as it did me. But I was really bothered every day that I would be on my deathbed and I would look back and see that I had ended my career. I'd coasted into retirement, staying as a spokesman for an industry that I did not believe in. That I had really sold out. And it just ate at me every day, to the point that I would look in the mirror and I'd say, who are you and how did you get here? And I was a reporter, as I said before, and a reporter as I was, it was my responsibility to make sure that people understood fact or had information that was correct and useful and complete. And I realized toward the end of my career that I was doing the exact opposite often than what I was doing as a reporter. I was misleading people purposely. One person who I talked to a lot before I made my decision to quit my job said that I was wavering so many times and thinking the worst would happen to me if I quit, or if I started speaking out against the industry. They would retaliate. I would be destroyed one way or another by the industry because they play, the stakes are very high. And he said, well, you can still push a broom, can't you? And I said, yeah, I probably can. And I know that sounds silly because I need to do more than push a broom, but I understood his point. I didn't have to be doing what I was doing. I could exist and probably be happier without all my stuff that I've accumulated over time. I didn't have to have all that stuff. And but I think a lot of people don't think they can do without their stuff. My dad couldn't take a bit of it with him when he died last week, and he didn't care about it. So, thank you.
Thank you.
Yes.
Why aren't businesses, large and small, enthusiastically in favor of single payer?
One of the things I've observed is that folks who are advocating for progressive change, particularly in our healthcare system, are not people who've come out of the corporate world. You have to kind of be in the corporate world to understand how they play the game and how they get what they want. You realize that they don't do anything without a well-thought-out strategy. And that's one thing, in my view, that has been lacking. The single-payer folks don't understand or haven't had the benefit of someone helping them develop a strategy. And that was another reason I wrote the book, was so that people can see how the special interests play the game, how they always get what they want. I'm not advocating using deceptive PR tactics that I outline in the book, but you don't have to. But you do have to develop a strategy, and you have to develop alliances with strange bedfellows sometimes to get what you want. The insurance industry has been able to discredit the notion of single payer for so long that it has become almost toxic in the business world. They equate that with higher taxes, and that's because the insurance industry wants you to think that it would be worse for business than their current situation is. So there hasn't been enough of an adequate educational effort to make people understand a single-payer system and its benefits. There hasn't been what we would call the business case. It hasn't been communicated. But the other thing is that big business, in particular, has benefited from the current system. They can attract the best and the brightest by offering health care benefits at the workplace. And you get, this thing called job lock going on. You work for a corporation. That's another reason I was somewhat hesitant to quit my job, because being an old guy like I am, it's not going to be so easy to get benefits. So you're locked in your job, and that's costing us a great deal economically, globally, because some of our best and brightest are not going out to start their own companies, or not joining small businesses, and that's where the real job growth is, and can be even more so. They benefit from that. They like the status quo because they can capture the best people and keep them there as long as they want them. They don't have any loyalty to them. They'll get rid of them when they're no longer of value to them. But people who are working in those jobs are afraid to leave them.